Welcome to Breathe California TV. I'm a volunteer for Breathe California. If you want to help out, just give a call to Breathe California in San Jose at 408-998-5865. We're talking today about ways to protect your health, community health programs, and we have three all-stars from the Breathe California staff. We're going to talk about programs that they work on. So stay tuned, and we'll be talking about wildfires, COVID, 12 or 13 different types of lung diseases, and the programs that Breathe California has. See you in 30 seconds.
The different therapeutic methods that we can help our very low socioeconomic status clients who have no alternatives, no anything, and there's still about 15 different resources we got out of this that if you have no resources, no service connection, you can still get aid.
That they are connected, one encourages the other, and that the process of change from backing off from the tobacco is the same as backing off from any other addictive drug.
Everyone can benefit from this training that we just were offered today. I would not take it back.
Welcome back to Breathe California TV. Breathe California has served about 40,000 people with breathing difficulties in this past year. I've been active in the group since 1973, and I would say we probably averaged 100,000 a year, so the epidemic has made a big problem. We were named Chapter of the Year 10 years ago, and I think we were doing 150,000 people there. So Breathe California is really working hard to improve your health. So first up is going to be Vanessa, Talania. So I'm going to ask each of our three guests, the others are Medha, Gelli, and Chiang, to describe what their jobs are, and then I will ask them to convert that into what it means of programs that they're providing for us and the public. So Vanessa, tell us a little bit about yourself, what your role is, maybe a little about Breathe California.
All right, thank you, Terry. I'm the program manager with our air quality program and also our senior health and wellness program. I pretty much oversee the planning, deliverables, and management of the whole program. I actually started as an intern for the senior health and wellness program here at Breathe California a couple of years ago. Meanwhile, I was finishing up my bachelor's degree in public health at San Jose State. So that's my brief introduction.
So now that we've ascertained that you're extremely qualified, what do you actually do? What kind of programs are you running?
Well, for the air quality program entirely, we focus on implementing the community action model, which is highly designed in grassroots organizing. So with that, we have the community residents needs community diagnosis, and we have their participation and pretty much involve them in the whole mitigation process on what needs to be changed in regards to mitigating air quality and air pollution.
So last month we had San Jose Council member Raul Perales on the show, and he talked about two smoking relating items, preventing vaping and electronic cigarettes and secondhand smoke in apartment buildings. Do you run those programs as well?
No, I do not. So that is a program that is run by my colleague, Talania.
Okay. So anything more before we switch over to exploring Medha's programs?
No, we can dive in more a little later.
So Medha, tell us a little bit about your background, and then you can catch a breath and we'll ask you what you're actually doing.
Sure, thank you. Hi, my name is Medha and I use she, her pronouns. I live in San Jose and I've been with Breathe California of the Bay Area as a community, emerging community leader for over a year. I'm a junior at Scripps College, majoring in environmental policy and minoring in data science.
So are you back down at Scripps now?
I'll be there in the fall. Yeah, they're reopening campus and I'm very excited.
Well, we appreciate your assistance. I retired last year from teaching at San Jose State, and I talked 20 or 30 of my students into helping out, although clean energy was the biggest thing they were doing for Breathe California. So you've worked for the last year. Did you do all Zoom classes at Scripps this last year? So you stayed at home?
Yeah, I've been at home doing Zoom classes for the fall and the spring. That's right.
So how is it doing services for Breathe California via Zoom?
It's been a little bit tricky. Obviously, we didn't know we were going to go online when we first started, both Anna and I. And we were kind of expecting to do in-person canvassing and things like that. But when we moved to the online model, I think we really were able to work as a team more efficiently. And we got a lot done even online, and I'm very proud of the progress we've made. We did a huge survey, which I can talk about a little bit later. And we were able to really hear what the community needs. And we created an air quality presentation and information. We were able to do that all successfully virtually.
So do be aggressive and remind me to come back to the survey if we haven't talked ourselves out with the three of you by the end of the show. Talk a little bit about your program. You should mention the survey. Other things that you had, maybe it was the survey. You've got in the notes you gave me some percentages of people responding to different ways. Our last show was with somebody on the Bay Area Air Quality Management Board, and they must be hearing you loud and clear because they put controls that many of us thought were long overdue on the 6 refineries, which provide the worst air quality that we have in the Bay Area in terms of health studies. Happily, none of them are in our county. But other things you want to talk about?
Yeah, I can talk more about that survey actually. We reached out to the San Jose community, especially in East San Jose, to determine people's interaction with air quality issues. And upon our analysis of the data, we found that of our 174 respondents, almost 100% are aware of these air quality issues, and a majority were very concerned about San Jose's poor air quality, exacerbating respiratory illnesses, worsening environmental health, and increasing cancer risk. About 53% of respondents noticed air quality negatively impacting their health through allergies, asthma, and difficulty breathing. And 85% of respondents noticed traffic and vehicles as the most contributing pollutant to worsening air quality in the Bay Area. And when they were given a range of solutions to choose from, residents expressed the desire to prioritize emissions reductions using clean air vehicles over other mitigation options. And it's actually funny that you mentioned the Bay Area Air Quality Management District, because we are trying to really influence them. Around 83% of respondents responded with neutral or disagree that the city council and mayor work toward and prioritize healthy air quality. This distrust was very concerning for us and indicative of the need for further intervention. of which only 36% of participants had or wished to participate in community action related to air quality. So this really told us that we need to get people really working in air quality issues, really educate them, and make sure that they know how to make a change. So some of the actions that we did this past year were providing public comments at important board meetings regarding the Charlotte Extension Project and the proposed VTA ban, following the Bay Area Electric Vehicle Acceleration Plan and the Great Oaks South Backup Generator Facility, and created and distributed informational pamphlets and delivered educational presentations on the impacts of air quality in the Bay Area that reached over 200 people. We also spoke to and wrote to San Jose City Council members such as Pam Foley, the City Planning Commission, and newspapers regarding air quality issues. So we really tried to make our message really strong and clear and spread it to as many people as possible.
So how significant do you think wildfires were in that awareness? We've had a number of alerts from the Air District and a lot of publicity about these wildfires impacting the breathability of our air.
Yeah, that was definitely a key part of our educational presentations. And Anna, do you want to say more about that?
Anything you want to say? We only have 20 minutes left.
Sure. So like Medha said, I think wildfires definitely brought a lot of publicity to the issue of air quality. So in our presentations, we also included a lot of information about prevention of wildfires and how residents can stay safe and be prepared. I remember last year when their sky was completely orange. There were lots of news stories about that, and I think that really brought the issue of air quality to the forefront of people's minds. Seeing that sky the whole day, the entire time, it was something that really brought the issue like right in front of people's windows and something that they could really see and visualize.
So I apologize, but I didn't give you a chance to introduce yourself before Anna. So please talk a little bit about your background, and then we may come back to you. Or you and Medha can fight for the microphone.
Sure. My name is Anna Chiang. I use she, her pronouns. I live in Milpitas, and I've also been with Breathe California as an emerging community leader for over a year, and I graduated recently from San Jose State with a degree in public health. So
we've given Vanessa and Medha a chance to talk about their programs. You've talked a little bit about wildfire, but I can't imagine that's you're limited to just working on wildfires. Otherwise, we'd have you out on the lines now, cutting paths to stop fires.
Mm-hmm. I also worked with Medha and our other ECLs on getting a perspective on the different attitudes and beliefs that people living in San Jose had. So I got to interview stakeholders in the community. One of them was the executive director of ICANN, Quinn Wong. ICANN was an organization that's based in San Jose, whose vision is to build a Vietnamese American community that is engaged, informed, and inspired to make a difference. And we learned from her about air quality issues and barriers that her community faces. And I also learned that ICANN was also working with the Air Quality Management District on an assessment of their own community as well. Medha actually had a chance, exciting opportunity, we all did, to have a presentation with Assembly Member Ash Kalra, and one of our former ECLs got to interview him, and I know I can let Medha share about the things that we learned through our interview with the assembly member and the things that they discussed.
So Ash has a long history of working well with us on things. He was on San Jose Council before, and he also chaired the board of directors for the Bay Area Air Quality Management District. So he's been immense help in both of his hats. Plus, he went to the same law school I did, Georgetown in Washington, D.C. So Medha, you had some more to say rather than me BSing.
No, that was actually, I was going to mention that he was on the board of directors at the Bay Area Air Quality Management District too. And he shared that when he first moved to the Bay Area, there was a huge brown cloud over the entire area. But over time, that brown cloud went away through regulations implemented by the Bay Area Air Quality Management District and work done by organizations such as Breathe California, as well as the California Air Resources Board, and that he was an active part of that process. We learned that 3 of the areas hit heaviest by COVID were near freeway intersections and in already highly polluted communities. And he added that factors such as having to go to work, even with the pandemic, underlying health conditions, and air pollution all mounted on top of one another in the communities hit hardest by COVID. And we really focused on East San Jose, which is one of those communities. So it was really, it really reinforced what we already knew. And it just showed how the data is progressively getting worse in these areas. Although he also did share that people are becoming more cognizant of air quality and tracking the air quality index, as Anna mentioned with the orange skies last fall. And so I think that it is getting a little bit more light, but there's still a lot more work that needs to be done.
So we're going to take our break right now, but we're going to come back and talk to these 3 ladies about environmental justice and other issues that they've been working on in about 30 seconds when our public service announcement is over.
My name is Rene Montez. I've been using the CPAP machine, I would guess 10 years. I got so accustomed to it, I don't go anywhere without it. I take it with me everywhere. From the moment I put it on, I thought it was the greatest thing because the breathing was a lot easier, and after using it for a couple nights, I felt a lot of energy. Breathe California is fabulous.
Welcome back. This is Breathe California TV. We're talking about community health programs that staff for Breathe California, the Bay Area, puts on. And 3 of the ladies responsible for this have joined us, Vanessa, Talania, Anna Chiang, and Medha Gelli. So who wants to tell us what in the heck environmental justice is? That's a term that my students always had problems with. Well, absent rebuttal from you, I will define it as the notion that everybody needs to be treated equally, not based on how poor they are or what kind of facilities are. One student defined it as every negative facility, undesirable facility, needed to be located within a quarter mile of the CEO's house. So Los Altos Hills and Saratoga would be getting a lot more of the hazardous waste disposal facilities than they do right now. Any of the 3 of you want to talk about what Breathe California is doing in that area or feeling that about the Air District's programs?
Yeah, I can talk a little bit more about the effects of air pollution and what our goal is for our Community Health Protection Plan program / project. So the Community Health Protection Plan program under Assembly Bill 617 is with the Bay Area Air Quality Management District, which pretty much means it is just requiring additional reporting, monitoring, and mitigation plans to measure an effort to reduce air pollution exposures in disadvantaged communities. And we're looking at East San Jose as one of those disadvantaged communities. So like I said earlier, the project implements a community action model that really focuses on needs assessment, organizing, and participation. So this is highly designed as a grassroots organization type of work where we meet with community residents firsthand, but unfortunately due to COVID-19, we were unable to do that. So essentially our goal is to really identify local air quality issues and recruit community engagement and participation through community advocacy and organizing to reduce and mitigate poor air quality in East San Jose. So, and I just want to share something that how does air pollution affect our health and environment? So, well, in the short term, air pollution can irritate the eyes, nose, and throat and make it difficult to breathe. In the long term, air pollution leads to the increase of a variety of health issues, including asthma, lung cancer, heart disease, and even premature death. So additionally, air pollution is one of the world's leading risk factors for death and leads to a shorter lifespan. So we're looking at globally, a 4.2 million premature deaths are linked to air pollution. 9% of deaths globally attributed to air pollution, and then 16 of lung cancer deaths, and then 25% of COPD deaths, and then 26% of respiratory infection deaths. So it is clear to say that air pollution is definitely a public health issue, and it is becoming more in the forefront of one of the public health issues that we're facing today.
So any of the three of you, one of the things that it seems to me air pollution does is reduce your resistance to getting other diseases. Is air quality problems prone to making COVID worse than it might have been if everybody was healthy?
Yes, I can discuss that. So we did learn that wildfire pollution and other forms of air pollution actually does increase the likelihood of contracting COVID-19 due to the increased susceptibility to respiratory infection. So especially during this time, during wildfire season, it's important to continue following safety precautions regarding COVID-19, remaining indoors when you can in filtered air spaces, replacing any sort of leaky windows, having a HEPA filter to keep your indoor air clean, drinking plenty of water, wearing a N95 respiratory mask, and speaking to your physician about a personalized safety plan for your respiratory health are all measures that people can take, since that air pollution and wildfire air pollution does increase the likelihood of contracting COVID-19. And Medha mentioned briefly earlier during the interview with Ash Cholera that the hardest hit areas were those areas that are nearby highways and more traffic. So we have been seeing that with COVID-19 and air pollution, that they are tied together.
So Margot Seidner, who's the executive director of Breathe California, was on this show 2 months ago, and she said that people wearing masks had reduced the incidence of other lung diseases, as well as helping with coronavirus. That talked me into wearing a mask everywhere I'm going, not just when I go indoors. So we've got about 5 minutes left. On the script the three of you gave me, what haven't we talked about? Any of you got something you want to add in here that I didn't ask you about?
Sure. I'd just like to inform people about other things that they can do to stay informed about air quality, such as if you haven't already yet gotten the Spare the Air alerts, you can sign up by texting the word START to the number 81757, getting the Spare the Air app, and signing up for air alert notifications by email. You can also look for tips on wildfire safety on the Bay Area Air Quality Management District website. They do have some great tips. And you can also search up the current air quality index in your area through the EPA air quality information. And if you have any other things that you'd like to learn about Breathe California, you can also visit our website at lungsareus.org as well.
Very cute website name, Lungs Are Us. The toy company that we were copying when we came up with that name has gone out of business. But we're still here and will be, what is it, 110 years? This year started out trying to fight tuberculosis. Largely got that covered and changed our name, and now tuberculosis has made a comeback. So any of you want to talk about who's most susceptible to lung diseases? Just don't point at me. I'm 75, so I got a letter from an organization when I was 50 and said, come join us. You're a senior now. So lungs through 15 years old and seniors are more susceptible towards lung diseases. Vanessa, you want to talk about community partners? You've been smart enough not to try to do this all alone, I guess.
Yeah, and I just wanted to add that, so yes, seniors are more susceptible, also children, and people who actually work out in the outdoors are more susceptible than others. So I just want to share that if you guys want to learn more about our projects and our programs, please do give us a call. We are at 408-998-5865 or visit us at www.lungsrus.org.
Medha, anything else in that survey that we might want to know about?
I think there's a lot of people interested in learning more about air quality, and they really want their public representatives to do something about it. And so this is going to be a huge push forward, and hopefully we can get more people elected into office that really support these issues and will do something more on it. We have a new administration working on it, and you know, it all starts from the local ground up, just like Breathe California. So I'm just hoping more people get informed and get involved.
So I'm very impressed that you sent a summary of the survey to San Jose City Council. In our county, they're more than half the population of the county. And so I'm disappointed that I get the Mercury News every day. I didn't see a story on the survey. You mentioned you'd send it to media, but it'd be nice to get our message out to everybody in the area to fully understand where we are and give us more support for both traditional health-based air quality concerns and climate change. Generally, climate change emissions are reducing our health problems, but people are often prone to treat air pollution and climate change like they're different subjects. So I see wrap it up. Vanessa, you want to give us about 20 seconds of what we're supposed to remember out of this? There won't be a test, however.
Yes, absolutely. Yeah. So get involved. Like Medha and Anna mentioned, you know, check out the Air District's website. There's a lot of information you can learn from there. Sign up on the Spare the Air Alert. And also, you know, there's a lot of programs that are being placed right now. And for instance, the EV acceleration plan that a lot of communities and disadvantaged communities can really take advantage of. And we are hoping to continue on with this project for another grant year and to really bridge the work we're doing with the community in East San Jose and really teaching them and letting them be a part of the decision process in reducing air quality issues.
So Vanessa, Medha, and Anna, thank you very much for joining us and keep up the good work. I hope our show next month will be as good as this one was. Thanks again.